Seizure is a state where a person has out of control electrical activity. Now, why is this happening? Why is this happening? Well, we don't know. It's either due to not enough, so too little inhibition, or too much excitation. And we don't really know which one, and almost certainly both are happening. It's just individual differences and patient to patient variation. But in either way, what's being shown here is an imbalance between glutamate and GABA. I talked about imbalance, particularly in this scenario, and how bad that could be. One of the problems with too much excitation or too little inhibition is seizures. Now, if you have a lot of people have one seizure and they never have another seizure. If that's the case, that is not epilepsy. So what is epilepsy? Epilepsy is where you have 2+ untriggered seizures. So what does untriggered mean? Untriggered meaning no obvious identifiable injury happened. There's no obvious external trigger. Let me talk about some triggered seizures. The most common cause of a non-epileptic seizure is brain injury. When you injure the brain, either falling, hitting your head, getting hit, heart attack, which can disrupt blood to the brain, cardiac arrest, which stops blood flow, respiratory distress, hypoxia, which is not enough oxygen. All of these can damage the brain and trigger a seizure. And they're all triggered seizures. If you have a seizure because you fell in the shower, that's not going to be automatically diagnosed as epilepsy. That's going to be a head injury that triggered a seizure. Another common cause of seizures in children is high fever. These are called febrile seizures. No, that's not correct. The word is febrile. Febrile. Febrile seizures. These are febrile means fever state. And again, imagine the brain when it gets to like 105 fever, that's going to be causing problems. Now, what's interesting, we talked in the disregard that. One interesting aspect of seizures is that they will immediately drop the body temperature. So this might be more planned, if you will, than it seems. This might just be a natural response of the brain when the body temperature spikes suddenly. Okay? But these are not necessarily dangerous. And if your child has one, that doesn't mean they're going to have another one. It doesn't mean they're going to become epileptic. It just means they had a high fever and their brain sort of freaked out and decided to take matters into its own hands. I think you've all seen seizures. What they look like, at least the big one, is person loses consciousness. They fall or slump over, and then they start violently shaking. That's a convulsion. Now, the reason they're having a convulsion is because, remember I said a seizure is wave after wave of action potentials running through the brain. Well, when that wave runs through the motor cortex, it's going to activate the entire body. So your whole body will tense up because the entire motor cortex gets activated. Okay, we'll talk about that again in a second. But there are generally two families of seizures, two families of epilepsy. Those that have generalized seizures and those that have partial. Now, generalized, as the name implies, involves most of the brain, even all of the brain. Partial seizures remain local. Now, when it comes to partial seizures, there are two kinds: simple versus complex. A simple partial seizure, the person is awake and conscious, and in complex partial, there's loss of consciousness. No memory for the event. They apparently are not there in the room with you. Okay? Now, grand mal seizure is the big major seizure. It's a large generalized seizure, often called a tonic-clonic seizure, because there are these two distinct phases. When a seizure first starts, the entire brain is having an electrical impulse. When that happens, your body becomes stiff as a board. Then the seizure goes through pulses. So you'll have a wave of electrical impulse, and then you'll have quiet brain, and then you'll have another wave, and then quiet brain. When this happens, your muscles tense, then they relax, tense, relax, tense, relax, and that gives that twitching, flopping appearance of the seizure. Okay, so first the tonic kicks, where the entire brain is seizing and you're stiff as a board, and then you begin to pulsate the muscle contractions, rhythmic jerking motions. We talked about how that happens. Two special situations worth mentioning: absence seizures. This is a special kind of generalized seizure where the person loses consciousness, but they can still talk. They appear awake, although out of it, and they just seem kind of inattentive, spaced out. I'll put a link to a video about showing an absence seizure, because there are a lot of patients out there that are trying to spread the word, because these are very difficult to diagnose, especially in children. Because the way it presents itself is the child will just sort of slow down and, yeah, mom? Things like this. Okay, so I was acting out. If I suddenly got an absence seizure, it would look like that. That looks a lot like attention problems, or it looks like a kid who's just being annoying. But alas, they're having absence grand mal, absence generalized seizures. Okay, status epilepticus is an extremely serious state. What this is basically a non-stop seizure. In these cases, the patient has to be put under a medically induced coma to stop the seizures. You have to pump the brain full of powerful inhibitory drugs to stop this, and we call that a medically induced coma. After a day or so, they'll reduce the doses and wake the patient up and see, are they still having seizures or have they stopped? Usually they still are. This often does not end well. High mortality and high uh, incidence of what's called persistent vegetative state. This is not coma, but it's not consciousness either. It's somewhere in the middle, closer to the coma end for a lot of patients. How do you get into status epilepticus? Well, massive brain injury is usually the way. I remember when I first learned about this, it was a long time ago, but poor guy went to a baseball game at Dodger Stadium. He was a Giants fan, and he was attacked, beaten, horribly beaten, and he was status epilepticus. He was in a medically induced coma for a long time. He survived, but he's in a very deep, persistent vegetative state. Okay. Okay. Those are seizure disorders. Well, let's talk about treatment. As you would imagine, you either reduce excitation or increase inhibition. There are many drugs that can do one or the other, and lots of drugs are used in seizure disorders. One of the most interesting things about these drugs is that they are also highly effective against certain psychiatric conditions, particularly bipolar disorder, which is another situation, guys, where you see what appears to be excessive brain excitation. Now, first aid for seizure, if you see someone having a seizure, you just have to do the following, okay? Protect the head. Lay on side. You want the saliva and vomit to come out of the mouth and not go into the lungs. You could imagine vomit in the lungs is an absolute disaster. This is it. Lay them down, cradle their head, roll them on their side, and let anything that comes out come out of their mouth. Don't put your hand in their mouth. Don't try to grab their tongue. Nothing's gonna happen except you're gonna get your fingers really injured. And call 911. Now, if this is your sister and she's had 7,000 seizures, you're not going to be calling 911 for every seizure. But if it's a stranger, or if it's a first time or second time seizure, never. Well, I was going to say never hurts to call 911, but of course it does. But if you're scared, just call 911. But do these two things first: protect the head. Wow. Protect the head and lay them on their side.